Hello.
Hello, hello,
Hi, how
Michelle.
are you?
Good, at last, finally.
I'm sorry I was
Um,
having such a bad internet.
okay, no worries.
I had to connect from my rooftop.
You did?
Yeah.
Okay, okay, that's all good. Where are you right now?
I'm in Algeria. How about
Mhm.
you?
I'm in Barcelona, so not that far away from you, considering the wall.
Yeah,
But
so we're basically in
yes,
the same time zone.
at least we're in the same time zone. Yes, late
Yeah.
afternoon, early evening.
Good evening. It's 6 p.m., right?
It's 6 p.m. Yes, 6 p.m.
Yes, good, great. So I've been looking forward to having this discussion with you. I'm a huge fan of your startup or company. I am not sure.
I'd rather say company. We've been around for quite some time, almost 10 years now. And
Okay.
although we like to consider ourselves a startup, we are much more on the scale up phase. I'd say we count with many customers right now worldwide, and we are much more looking into extending the footprint and entering new markets and so forth, but not just starting up things, no? So yeah,
Oh,
a bit in the middle. We are a bit in the middle in the end.
okay, that's great. So, if you could just tell us a bit about yourself and about Mediktor, is that the right pronunciation?
Yes, Mediktor. That's the name. That's the name indeed.
What does it mean?
Nothing in particular. It's honestly, I have to tell you, I've never asked where the name came from. Obviously, it relates to medical because it's everything that has to do with everything we do has to do with the healthcare, and we are reinforced by doctors, I'd say, and clinicians. The Medictor as such, I don't know. Maybe it's like predictor because it's giving you an indication of a condition that you may have. It has to be
Mm-hmm.
something related to that, but I couldn't speak to the rounds of the name. I mean, I never asked. Maybe it's something I need to do.
Okay, you have something to talk about next time you meet up with the founders.
Yes, indeed.
So yeah, go ahead and tell us about yourself and about the Medictor.
Yeah, thanks. Well, first of all, thanks for the opportunity to share with you what we do and so forth. I mean, just to give you a brief introduction, my name is Sergio. As I was saying before, I'm in Spain, in Catalonia in particular, in Barcelona. Mediktor, it's a Barcelona-based company, so we work here. We have here our headquarters. What I'm doing at Mediktor, it's business development activities. I'm leading the business development at Mediktor, and as I also said before, what we are trying to do as part of our strategy is to extend our footprint and to consolidate our markets. I'd say we're in a number of countries and regions today, and our intention is to extend there. Personally, I have quite some experience, I'd say, around healthcare. I've been working in healthcare for more than 20 years now. Initially as a consultant in different companies, and I've been exposed always to information systems, being those hospital information systems, clinical information systems, then moving to some others. And it's been just recently, a bit less than a year, that I joined Medictor to help in the expansion of the company. So that would be me with regards to Medictor and what we do. Medictor, I'd say just as an intro point that it's a company that has the aim of facilitating the access to healthcare to everyone in general. If we would consider our mission, that would be the best way to define it. Because what we understand and what we've seen for many years is that there are difficulties around the world to access healthcare for numerous reasons. It could be because of the ruralization of a huge part of the world's population, or in more developed countries, it can be the fact that the systems are, if not collapsing, they are close to collapse. I mean, there is a huge demand these services. And all in all, there is a lack of efficiency, right? I mean, you have more and more people accessing the system, and there is a need to articulate the right means, let's say, to facilitate that access. So in the case of Mediktor, understanding that that's a problem and that our mission is to make that easy for everybody, what we do, and the means that we use to provide that access to healthcare, it's by what we like to say it's that the most accurate virtual medical assistant, which is in more plain words, I'd say it's a symptom checker. It's a symptom checker that it's based on that it's targeting two things and two main things. The first one is to provide a pre-diagnose of the conditions that any user, any potential patient might be having at a given moment. And not only that, the intention and what we can do is to provide a level of emergency, a level of urgency, like the level of urgency that you could be receiving when visiting the emergency room at any hospital, right? So that's what we are trying to do. Together with that, what we do is that we provide information on what is the next best step, right? Meaning that if you have this condition and you have this severity or this urgency on that condition, then this is what you should be doing. Normally, we provide a set of endpoints, like saying you need to go to an emergency room, maybe you can visit a doctor, specific physician, a specialty, something like that, right? So this is what we this is basically what we provide. What it's good about, or what we like to think that it's good about Mediktor, it's the fact that the information that we provide, it's been clinically validated. So for instance, when comparing to something that could be, someone could be thinking that it's what we do, right? It's like going to Google, I go to Google, I Google my symptoms, and then I get a response from Google telling me that I might have this condition, right? I mean, this is something that you could do, but normally you will be misled about the condition that you might be having, simply because there is no clinical evidence behind that information you can collect. In that case, and what we do, as I said before, is that we have a clinical validation of the information we provide. This is something that we've done and that we constantly do. So make sure that the information that we give the user / patient, it's clinically reliable, because it needs to be, because if not, it's useless. Basically, we will be doing the same as asking your mom or asking Google. It wouldn't make any sense. So that's what we do. In that sense, the core of Mediktor and how we do that, or how we can provide that, it's by means of a massive clinical database that Mediktor clinical team has been developing and producing, I'd say, for these 10 years that Mediktor has been on the business, and that up to now it's collecting hundreds of diseases and conditions that can be identified on the basis of symptoms, of which we handle thousands of symptoms as well. And we do all of that by asking the specific questions, right? The point here is that on the basis of symptoms provided by the user, we mixed all the information, we raise the next best question, we get a response, we raise then the other next best question until we get to a result. Being that result, as I stated before, a pre-diagnosis, meaning that this is the set of conditions that you, as a patient in this case, might be having, and this is the severity or the urgency, rather say the urgency of the condition that you are that you are having, right? I mean, that's the outcome that we provide.
Yeah, I think that's really, really interesting, because personally, as a medical student, I spend a lot of time in our emergency rooms in Algeria, and I think they are pretty hectic. I mean, we get patients who literally don't know what they have, whether they have a urgent case or a basic case that doesn't need to go to the emergency room at all, but they would still come and like really crowd the emergency room, and this could be something really bad for the patients who actually need the emergency room. They take of their time. So I believe that Medictor is like a mass triage, which could really help the collapsing healthcare systems. So yeah, so that's pretty amazing, I think. And you've talked already about how does Medictor help patients, but how does it help healthcare professionals?
With healthcare professionals and institutions, I'd say that the help that Mediktor provides, it's the one that you were describing. No, I mean, getting back
Mm-hmm.
to my first point when I was saying that there is a general need for efficiency in the healthcare systems around the world. This is what we believe that we can provide, right? I mean, the perfect example is those crowded emergency rooms with patients that probably should not even be there in the first place,
Yeah.
right? So the chance of having uh, first a digital interaction with in an off meaning off-site no interaction with patients, it's providing the healthcare institutions as well as the professionals with the means to really identify which patients are the ones that should be going to a facility and which are the ones that should not be going to a facility, just as a one initial use case in which we can provide that type of assistance, right? So in that sense, this is what we do, right? I mean, it's here in the end, it's the possibility, let's say, to gather relevant clinical information that can be used during the healthcare process in the most appropriate way. One other way by which we define Medictor as well, in the sense of what we do, is that we are proud to say that we can bring the patients to the right level of care in the right moment. So in that
Mm-hmm.
sense, that speaks to the efficiency, right? I mean,
Yeah.
there again, let's the COVID situation and the pandemic, no, which I believe that we might discuss as well. The thing with the pandemic is that it has made so evident that it was dangerous and that it is dangerous indeed still today. The fact of sending people to the emergency room if not needed, that having the chance to run through these assessments in a remote manner so as to
Mm-hmm.
provide the information that healthcare professionals, eventually public health responsibles, and all these people that have to deal with these situations, if they have this information up front, they have the chance to decide on the basis of that information. So for instance, Medictor being used in a context in which we are managing that for a region in which we want to identify COVID, for instance, knowing in advance if that particular set of population are identifying, so to speak, those symptoms at an early stage, it's an opportunity to define protocols for those patients. Because, for instance, combining the symptoms provided with how urgent, let's say, those symptoms become based on the symptoms and the situation that they are describing, this might eventually provide those opportunities to define protocols like, for instance, let's go and send the test to these people's home directly so we prevent them from going to a hospital, or they are in a serious condition, let's make sure that we get them to the hospital, but eventually let's get them safely, let's get them by ambulance, something like that. And in some other cases it's just, okay, let's provide some peace of mind, let's make them stay home, right? So just as an example, back to the point about how this benefits healthcare facilities and the professionals relates to this. No, it's offloading pressure from the system, because yet again, you are only in need of treating that particular patient when that particular
Mm-hmm.
treatment is needed, for instance, in a given facility, right? One
Yeah.
other thing that is becoming more and more evident is what happens around telemedicine, right? I mean, now these days it seems to be something normal and that we use every day, but this is not something that happened 1 year ago. I mean, we've been seeing that all these telemedicine activities, let's say, multiplying by thousands in thousands and thousands compared to last year. But yet again, this only speaks to how efficient the process can be or can become. Let's say this healthcare process can become this efficient just by applying these tools, right? And for instance, in this case, also speaking about telemedicine, yet again, Medictor can help because of what I said before, right? I mean, eventually, by understanding the symptoms, the condition that that patient might be having, and how urgent that condition might
Mm-hmm.
be, as well as I was saying that we may define this person needs to go to emergency room, or this person needs to go and visit a specific specialist. The same would go for telemedicine, because it's like, okay, go to telemedicine, but you need to speak to this specialist. And maybe your condition is urgent, you need to start a chat now or a video call now. Maybe it's not that urgent, and what you can do is schedule a video call with a specialist in a week from now. Things like that, right? So being at the starting point of the process, I'd say, we believe that we can help in producing those efficiencies that would benefit as you were asking, health professionals and institutions in the end.
Yeah, so speaking of the COVID pandemic, I personally believe that going to an emergency room right now in the midst of the pandemic not only is unnecessary in some cases, but more like dangerous. You could not have the virus, but by going to a hospital which is crowded by COVID patients, you can go back home having the virus and transmitting it to your whole family. That's why I think such a technology which would help you, which will guide you, go to the right facility without having to go by such a dangerous place, which is the emergency room, is really, really a big improvement the COVID has brought to the healthcare system.
Yeah.
Yeah,
It,
unfortunately, we still don't have this sort of technology in Algeria, but I hope we will get there.
no, the thing, Vishal, I think that the problem is global, probably in different scale in the different countries or regions, but the problem remains. And that is something that I wanted to share with you as well. No, probably later we can elaborate on that. But in any case, with Mediktor, as well as with other domains, let's say in telehealth and some other things that are happening out there, we're speaking about an innovation. No, and when we're discussing innovation, in some cases, it's difficult to accept that innovation. No? I mean,
Mm-hmm.
the reality is that there is a benefit, but putting it through, so to speak, just to make sure that it's used and that it produces the benefits that I was describing before, it takes time. Even in these hard times with the pandemic, it's something that it's taking time. No, I mean, for instance, consider with Mediktor and for instance, I mean, related to what we did with COVID. I mean, we produced a specific app, we would say, or a specific solution that was COVID related, meaning that we took a subset of the general Medictor with all the conditions, all the diseases, and all of that, and it was fine tuned to better identify cases related to COVID, but even extending those, because it's not only a question of COVID. Eventually, somebody has a pulmonary disease that needs treatment, so maybe you don't
Mm-hmm.
have it, but you get a result for something else. But besides what we do around that, the big point I'd say with Medictor and COVID, it's once again the chance to identify a situation or a potential COVID case way up in the process, right? I mean, if you take the COVID patient journey as it may happen today, in many cases, at least for what we've explored, I mean, you only get a COVID positive when you have a PCR test or a whatever test, and you have a positive result out of that test, right? But the
Mm-hmm.
thing is that it may take days, right, until you get there, because somebody starts feeling unwell. Then it's deciding, should I call somewhere, yes or no? Should I go to the hospital, yes or no? Some days go by, and then it's only when that person goes through the test and gets a positive that you get a positive result, and then you start with the contact tracing and all these things that many countries are doing, right? But
Yeah.
we believe that we are losing precious time in there, because if you would have the chance to work with prior information like the symptom related one and act upon that one, on those protocols that I was describing before, and you do that at a regional level, meaning with scale, then you are somehow gaining all those days there, right? I mean, it's not that you
Mm-hmm.
have to wait for 1 week until you have the positive result. Maybe you have the indication almost immediately that something might be wrong with that person, and you can act on the basis of that, right? So even,
Yeah.
for instance, as you were suggesting, or as you were saying, preventing that person from going to a hospital facility, right? Because maybe
Yeah.
that's what you don't need given these conditions.
Exactly. And speaking of the pandemic, how would you describe the way that it has affected the business model of Medictor?
Well, what I would say here is that maybe it's not that politically correct to say this, but there's been a positive side to the pandemic, and obviously when it comes down to adoption of technology, obviously
Yeah.
everything else has not been positive and will never be, right? But with regards to the adoption of technology, the fact of the pandemic forcing this adoption of the innovation,
Mm-hmm.
as I was stating, mostly related to the teleconsultations and telehealth in general, this has dramatically affected the business model, right? Because we had something that was purely an innovation, and all the work that we were doing in informing, communicating, convincing decision makers on the decision makers on the healthcare domain to really adopt this innovation and this technology, this has somehow been easier. So I would tell you
Yeah.
that during the last year and the last few months at least, we've had many more business related conversations compared to the ones that we had 1 year ago, 2 years ago, things like that,
Mm-hmm.
right? So from the point of view of the opportunities for the business, I think that those have grown, but for the best, because as we said before, I mean, we believe that this technology can help, right? So it's
Yes.
a positive side of the story. At the same time, I think that the pandemic is so big and it's impacting companies and people around the world in such a massive way, I'd say that in any case, we are suffering that as well, right? Because on the one end, there are a number of decisions with many companies that should be deciding upon this type of technologies that have been postponed or delayed. So despite of this being something needed, we can always agree that we will always agree that there are some other needs that come first, right? So when with regards to treatment and the vaccines and all these type of things,
Yeah.
so probably the focus is right now there. I mean, when it comes down to preventing and even helping out, maybe this comes second. So in that sense, some decisions around this may have been postponed. And in general terms, the economy it's suffering, right? So when it
Yes.
comes down to setting up projects and getting the funding for those projects, it's something that proves challenging. No? So in the end, it's a mix of the two, right? On the one end,
Yeah.
because I truly believe that in the end, this pandemic will leave something good with regards to having progressed in 1 year what we would have probably progressed normally in 10 or 20 years in the sense of adoption of the technology. And hopefully in 1 year from now, we will see a stabilization of the telehealth and eventually all these additional components like Mediktor that can play a role in that. So that we will see. But yeah, at the same time, I think that we need some getting back to normal with regards to the economy and stability on the economical environment to really produce projects that can make the difference. No, I think that we will need them both.
Yeah, I have the same opinion about the impact of the pandemic on the economy and especially on the healthcare companies. I truly believe, and I'm not even sorry for saying that it has had a great impact on them. It has accelerated the growth of many companies in healthcare. And so the next point I want to talk about is how is Medicare planning to adjust to the post-COVID world?
Yes, with regards to the day after, so to speak, I think that relates to what I just said. No, I mean, I truly believe and I hope because it would be beneficial for everybody that that something remains with regards to the things that we have been able to push through right now. And once again, I'm speaking about medicine and all the innovations like for instance this symptom checking that we propose, right? So in that sense, I truly hope that, well, it's not going to be the only way by which we will be dealing with healthcare conditions and so forth, because this is here to complement what already exists. I do hope that this plays a more significant role than it's been playing during the past few years, right? So finding that middle ground in which we will all again benefit from the technology and really adopt the technology and see it as an ally and not as an enemy, let's say, will be the best possible scenario, right? I mean, once again, I mean, thinking that this will replace everything and that all of a sudden everything will be so technological and artificial intelligence will be taking over and these things, that shouldn't happen and that won't happen. I mean, at the end of the day, this is something that still requires the knowledge of the people. It's healthcare, it's still a people business, right? And will remain being so. I think so. In that sense, finding again, no, I mean, I think it's a better way to put it, right? I mean, finding that middle ground in which technology and physicians and patients and companies, let's say, will operate together for a better healthcare for everybody.
Yeah, thank you for that amazing answer. And I have checked the website of Mediktor, and I saw that your team is a very diverse team. It has healthcare professionals, it has data scientists, and I want to focus on the healthcare professionals. How do you think that this pandemic and this whole health tech flourishing, how will that create new job opportunities for the healthcare professionals?
About that's a very good question, because it's thinking about how the future might look like for healthcare professionals, right? I mean, I can give my opinion here. I mean, I'm absolutely irrelevant, most probably, with regards to defining the future of how doctors, physicians, clinicians in general will, how that future will look like. But what I can say from the point of view of what we deal with regards to technology, it's that more than new roles eventually, and maybe we can discuss them separately. Eventually, there will be some new roles that we can think of, but more than new roles specifically related to healthcare, what I believe is that there will be, and I think it's urgent, that there will be a need to really adopt technology within the healthcare profession, right? I mean,
Mm-hmm.
until now, as I was telling you before, I mean, I've been working in healthcare for 20 years, and I've been living through the ages in which information systems were not even there. I mean, I recall times and projects when we were discussing the need for a clinical health record, electronic health record, and all of this, right? So starting from there, I think that there is that need, let's say, to make sure that the healthcare profession is understood together with the technology, right?
Mm-hmm.
So in that sense, the better professionals understand that technology is there to help, again, that ally that I was saying before, not the enemy, the better we all understand, and professionals in particular understand that technology is there to help, the better the healthcare profession will become in the future, right? Because one way or the other, we will have to deal with this. It will be through technology like the one that we provide, or again, through telehealth, or it will be through extended electronic health records that I cannot even imagine right now how they will look like in 10 or 20 years, but probably being patient-centric will transform a number of things, right? So it's a question of adopting. So probably the same professions that we have now reinforced with that technological component, understood as a help to what they do normally. Yet again, to me,
Mm-hmm.
healthcare, it's a people business. Understanding that combination is the one that will make the biggest change, I'd say. To me, it's what is relevant, right? To me, that's what we should be looking at in the future of the healthcare profession. That said, if we think about what might be related like to data scientists and all these additional professions or additional tasks or jobs, I'd say, that we might find on around healthcare or within healthcare, I'd say definitely those will be there. No, I mean, everything that has to do with artificial intelligence, with the big data, all these type of things are there to stay once again. And I think that there will be definitely some professionals in the healthcare domain that have this this healthcare background, that they can add a lot of value in training
Mm-hmm.
machines, analyzing the data, in all these type of jobs that probably will be new and will become more important. Because yet again, I mean, we have to find that perfect symbiosis, right, in between the technology and the healthcare profession. So probably these people will be in the middle, and there will be opportunities for these professionals, which are really technology adopters and technology lovers, I'd say, to really dig deeper into the capacity and the capabilities of that technology that once trained, once analyzed, and once worked on will be capable, let's say, of adding value to the rest of healthcare professionals that will have to deal with, let's say, sorry for that, with the daily business of physicians, clinicians, and doctors.
Yeah, I absolutely agree on everything you said. And that's basically it. That's everything I wanted to discuss. If you have anything to add, please go ahead.
No, not really. I mean, yet again, Vishal, just thank you for the opportunity to discuss all these topics with you. I believe it's the scale that we can share this and try to put it out there for everybody. No, but I think that the debate it's needed. Once again, the
Mm-hmm.
mix in between technology and healthcare. It's even more needed in these days. We've seen that with the pandemic, and it will be more than needed in the future. No, and yet again, I think that there needs to be this agreement, this handshaking, and this cooperation in between technology people and healthcare people, because we all have the same aim, no? Which once again, and back to the initial point that I was stating, that it's our mission and part of our values. We need to make healthcare accessible for everybody, no? And that means a lot of things, amongst which everything that we discussed this evening.
Yeah, thank you so much for being here. It's been an honor to talk to you. It's been a fruitful debate.
Okay, so I think thanks to you, Rizal. Thanks for the opportunity.
Thank you. Thank you for being here. Have a good night.
You too. Stay safe. Bye.
You too.
Bye. Bye.
Bye bye.
Bye.